I've been trying to scan it for a while, but I can't.
Why? Can you see the code?
Yes, but it's not scanning. I'm not sure why.
Well, you see where it says below it, the code? Put the code in.
I'm sorry?
You see here where it says the actual code? Put that in.
Okay.
Try that. So I am recording this for your benefit, actually. Oh, somebody's cat, how cute. So what I'm going to do is the format of today. It's like I have an audience of one, and it's a kitten. That's what I can see. So it's sort of cute. Anyway, I do want to do a HESI prep today. I also thought what I would do is go over NSADS, which is chapter 44, and I'm going to incorporate some group work in that. There's some case studies, and you may have seen in the announcements that there's 5 groups. What I'm going to do is basically sort of put you in groups of 6 or 7, give you half an hour, and you can upload your answers to that. We can talk about it. There's some questions that we need to talk about, meaning how are we going to move forward? I'm thinking day 10 or whatever is going to be Sunday. So hopefully we can be back on campus on Monday. And then my goal is week 8, of course, is your HESI. Week 9, from my perspective, I was thinking we could potentially do a quiz on Monday and an exam on Wednesday, and then that would get you back on track for week 10 for your final HESI rather than following through to the following week. So any thoughts, questions, what you're thinking?
Sounds amazing.
Who said that?
I did, Zoria.
Zoria? Well, so because I know that some people are concerned, would you generally prefer to do something like that as opposed to waiting to break week? Would that work for you guys?
I'd be okay with it as long as we could do some prep on, some prep material on Friday or Thursday, something like that.
Yeah. So,
what the fuck is going on, Majay? What the fuck is up with you, you pussy bitch?
Say that again?
I think we were talking about the cat.
Oh, the cat. Oh, okay. We're talking about the cat. All right. Yeah, so the quiz is 25 questions and it would be endo. And the exam 3 we're going to be doing is antibiotics and a little bit of cardiac, I think. And I think there's sort of a little bit of, certain things thrown in. But yes, I will prep you guys well. So what I was thinking is next Monday when we're back in class, I don't know if we could do the HESI then. That would be quite nice if we could, to get it out the way. And then Wednesday, we would be back on track, and I can prep you for week 9 for the quiz and the exam. So if we're allowed to do the HESI on Monday, then that would make more sense to me. So I'll speak to the DON and see if that's possible. And of course, I'll have to make sure the room is available as well. But would that work for you all? Anybody?
Hi, Ms. Fletcher. Could you repeat that?
What I'm thinking, so I think we're back on campus Monday, I think. If that's possible, I would like us to be able to do the practice HESI on Monday, if we can, rather than Wednesday. Get the practice HESI done and out the way, because we're behind anyway. It should have been done today. I'm sorry, whatever day we're on. What day are we? Should be done this week. And then if we do that, then we could do week 9, we could do a quiz on Monday and the exam on Wednesday. And then week 10, you just have your HESI final and that's it. Either way, week 8, you're going to do the practice HESI. It's just week 9, I want to give you the opportunity to have lots of prep related to the quiz, which is going to be 25 questions to do with endo, and the exam, which is going to be a lot of antibiotics, but also some of the cardiac chapters. So, you know, if you let me know what you think about that, if you think that might be workable, as long as I give you plenty of prep, then, you know, I think that.
Do you want to try a show of hands for who likes the idea and who doesn't?
Yeah. So let me have a show of hands for, first of all, week 9, doing the quiz on Monday and the exam on Wednesday. So we have the majority of people, 20. Wow, that's like nearly all of you. 20 plus people. Okay. All right. Well, let me see if I can plan to do that then. And that way that will get you guys back on track. And then the only other piece for me to try and figure out is if I can do the practice HESI on Monday, then that might be helpful for you. If I can do that, I will organize that. And of course, I'll try and figure that out a bit later today. I'll send an email. All right. So
Ms. Fletcher?
Yes.
I have a question about the quiz and the exam. You're saying Monday and Wednesday. Would that be August the 2nd and August the 4th?
Yes, it would. So it would play out week 8, the HESI, either the Monday or Wednesday. So that would be either the 26th or the 28th, depending on which I can get approved. Week 9, it would be August the 2nd, Monday, for the quiz, which is endo. 25 questions on endo, on the endo chapters. And then Wednesday would be the exam 3. That would be August the 4th. And that would be antibiotics and cardiac. And then that would get you back on track to do your HESI final on August the 11th. So that's what I'm thinking as a plan. Of course, we all know how the plans go, right? But I'm going to try my best to see if I can make that happen. Does that sound reasonable? Oh, lots of people have their hands up still, or is it just that, do you know how to, I think you can take your hands down. You can just re-click that thing and it will drop your hands unless people have questions. Anybody have a question? I see hands up still. So I don't know if they have questions or not. Any questions? No? Okay. All right, fantastic. So why don't we, okay, first thing before I get into the HESI prep, I met a lot of you doing one-on-ones. Everybody who has not done a one-on-one with me needs to do that today. And there's still about 12 of you, 13 of you. I'm going to call your names out. I've got William. Jordan is at 3. I've got Leah, Jabria, Ashley, Michaela, I've got you at 3:15. Kitaria, Sierra, Susa Lee, Zoria, Mercedes, Lakia, Tabitha, I've got you at 3:30, Tiffany and Kanisha. So all of you, I need to do your one-on-ones after class. And I'm just going to keep rolling with it. So, you know, what I suggest you do is maybe, well, let me think about how we can figure that out. People have hands up. Yes.
I been trying to email you and send you messages about meeting since you posted it the first time. I just haven't got a response back.
What are you trying to send me an email about, though? Did you send me an email?
One-on-one, yes.
Mm-hmm. What time? Hello?
Hi.
Okay, so I don't know who it is that's saying, who's talking to me.
It's Tiffany.
Tiffany.
Mm-hmm.
All right, so Tiffany, let's do 3:45, 3:45.
Okay.
Okay. Who else? Let's quickly get this done.
Oh,
I didn't know you.
Okay, Tiffany, I've got you at 3:45. Who's at 4 o'clock?
If we didn't see our name on that list, I didn't think that we needed to have a meeting with you.
Everybody has to do. Everybody has to do a one-on-one. Not my choice. Everybody has to do a one-on-one.
I just didn't know that, so I can schedule whenever.
Yeah, those were the first people that I needed to deal with.
Ms.
So
Fletcher, this is Billy. Can I do the latest possible one?
what about 4:45?
Perfect.
5 o'clock. 5 o'clock.
Perfect.
Okay.
Dr. Fletcher, this is Mercedes. You can put me at whenever.
Okay, Mercedes.
Hey.
Let's put you at 4:45.
Miss Fletcher, this is Ashley. Can I do 4:30?
Ashley. I'm trying to find you, Ashley. 4:30. Gotcha.
Yes. Okay, and how we just meet on Teams, or how are you reaching
I'm
out
just
to
going
me?
to keep on with this. This is just going to be okay. Who else? Leah, Jabria.
Professor Fletcher, this is Leah. Did you still have 4 available?
I
today?
do.
I would like that one, please, if that's okay.
Perfect.
Miss Fletcher, this is Zoria. What else do you have available today?
I have 4:15.
I'll do that one.
Okay.
Fletcher, this is Kanisha. I'm available anytime.
Kanisha, let me see. Give me a second here. Kanisha. I may have to go a bit later than 5, actually. Why don't we do 5:15? I know you wanted the latest possible, but all right. So Kanisha, 5:15. Sierra?
Yes. What else do you have available?
Let's see. I'm just going to have to keep going till later. It'll probably only take 10 minutes, a couple of minutes.
Okay. And then I don't know what your plans are for tomorrow are, but we don't have class tomorrow either, so.
It's awkward for me tomorrow. But let's just
okay.
I'll just try and keep going because it probably won't take that. It's only going to take a couple of minutes with each of you guys. So let's see, I've got Jabria, Sierra, Kitara, Susa Lee, Lakia, wow, I've got a lot of you guys. Yeah, I may have to do tomorrow as
You
well.
can't do 2 at a time, or like, I don't know if you cannot discuss
can,
the
but-
grades.
I can. I sort of want to do a quick one-on-one with you guys.
Okay.
Let me do this. But so here are the people that are left. Jabria, Kitaria, Sierra, Suzalee, Lakia.
Bless you.
Just you guys. Why don't I plan Tuesday, tomorrow, from I should be finished. Let me say from 4 till 6. So it'll be this Teams link, and just send me an email, a quick email, and you know, we'll figure it out. If you all end up, you know, well, give me times from 4 till 6 tomorrow. Let's just quickly do it. So who have I got first on this little list? Tomorrow at 4.
Oh, sorry, this is Sierra. I wanted to say I work tomorrow, so whatever later available time you have.
Tomorrow?
Yes.
Let's do, can you do 5:30?
Yeah, I hope so. Yeah, should be fine.
Okay. I've got to do a one-on-one with you. Can you do 6?
6 would work better, yes.
All right, plan on 6. Kitaria. Are you here? You're not here.
This is Jabria. Can you hear me?
Yes, I can.
Okay, I could do tomorrow at 4.
Okay. Okay, let's see who else I have. Kitaria's not here, is that correct? Suzalee?
Yes.
What time tomorrow?
Whenever.
Why don't we do it 5:30?
Okay.
Lakia? Lakia? Okay, so she's not here.
I'm sorry, Dr. Fletcher. I know you said my time already. It's Mercedes. Can you tell me one more time, please?
See it is 4:45 today.
Okay, thank you.
You're welcome. Okay, and things might get a little jumbled. We'll just do the best we can, right? I say it's a lot easier when I can see you face to face, quite honestly. Or I can, you know, there's ways of setting up different links and things, but whatever. All right, so we have a plan. Let me just quickly look at this and see who's here and who isn't. So Juliana, you still can't get in?
No, ma'am.
Okay. All right. Kitaria's not here, and sorry to do all this to you guys. I know I'm slowing you guys down. I'm a little confused. Kitaria is not here. Lakia, why does it say that you're here but you're not answering me? Lakia, either you're here or you're not.
She might have stepped away from her computer for a second.
Might be something wrong with her microphone. First couple of weeks I couldn't get the microphone, so I used the chat.
So then, Lakia, if you can hear me, I need you to contact me on my phone via Teams. If you haven't downloaded Teams, I need to hear and realize that you are actually in the class. Lakia, I see that you are on the app. So
Are you asking for me?
That's wrong.
beg your pardon?
Are you asking for me? I'm sorry, I had to use the restroom.
Lakia?
Yes.
Okay, you are here. I need to do a one-on-one with you. When are you going to do it? Are you going to do it tomorrow? I'm available
Yes.
between. All right.
Yes.
So
What is it for?
a one-on-one to go over how you're doing, and it'll be, I have available time at 4:30 tomorrow.
That works.
All right. It'll be this same link.
Okay.
Okay, thank you. All right. So, good, I can get rid of this. So you can mute it now. All right, so I still see lots of hands up. I don't know if they're supposed to be up or if you're just not sure how to put the hands down. I think you can just click back on it. So let's do this. First of all, I want to show the people that I spoke to with one-on-ones. What I did, I went into your HESI tile and I showed you a couple of things, and I want to reiterate this to everybody. It's a nice way of giving you, I'm sorry, I'm in the wrong one. You go in your HESI. So I'm going to share my screen. If you go to additional resources, can you all see this, by the way? Anybody?
Yes.
Okay, good.
Yes, we can.
Great.
Yes.
So if you go to additional resources, you will see this piece here. Mine is the older edition, by the way. It's the 7th. I think you have the 8th. If you go in here, click on this. I think you have a lot of different pieces in here that can be helpful for you. One of them, for instance, is animations. I think you probably have this. But I was looking at it earlier because it has some things like, things like this. If you wanted an overview of the endocrine, it has a little video for you. Just sort of brief things going over endocrine, going over insulin. So that's just an idea for you for one option. The other thing I want to point out is different teaching tools that I think you probably have access to. I'm not sure if you have access to everything that I have access to, but this is the big one that I wanted to show you. Has anybody used this or not?
Yes.
A couple of people?
I haven't used it.
Okay. So it's a really nice way of studying, and what I think it will be helpful for you is really learning more those test-taking strategies, because a lot of the time it's not that you don't know the answer, it's that we think we know the answer rather than what the question is actually asking us. So my suggestion would be to go in under study. It will give you feedback. If you go to the content area, go to farm, and you can pull up the different areas. So for instance, if you're really unsure about endocrine, I'm just going to use endocrine as an example. You got 100 questions on endocrine. So you can begin this. And this is an example that I showed some of the other groups. So this question is actually saying the opposite of what our brains might think. If you look at this in bold, it says, what is indicating that the person that we're trying to teach needs extra teaching? So it's not necessarily these pieces, because these are correct, But if the patient did that first, would that be correct or not?
Not.
Right. Exactly. So this is the right answer. Does that make sense, or is that confusing?
It makes sense.
Makes sense.
It makes sense when we think it through. But if we just saw this question, we may be tempted to go with one of these other ones. So under the study component, it gives you the rationale and it gives you strategies. Okay? So my suggestion is that you start using this, if you're not using it, to help you learn. The other thing I like about it, if you go to this piece, and remember all of this is being recorded and I'll upload it, so you don't need to worry about that. But if you go to fill in the blank, if you go to this alternate item formats, fill in the blank, you've got dosage calc. So again, you can do some dosage calc, and doing it in the study will give you the rationale and the strategy as well. Okay, so I wanted to show you these pieces on the HESI tile that you may not have looked at because I think they can be helpful for you. What do you think?
Yes. I think it'll help. Thank you for showing us that.
Yeah, and as I say, this is recorded on purpose so that you can go back to those items as well and go, what was she talking about? And have a look at it, okay? So the next piece I want to do is some HESI prep with you guys. And let me just see. Yeah, I know we went over, you've got the list, haven't you, in the announcements of the concepts that you need to know. Hey, you got a question? No?
This is DeQuisha. I hate to interrupt you guys, but last week I had mentioned in class that I had a list of medications that I thought that you gave us, but it was from Professor Silva. So last night I did some comparisons with the list, and it's nothing wrong with your list. It was perfect. But I see that it was some things that she included that you left out and some things that you included that she left out, or however it goes. But I wanted to see if I can send that to you first, and then if you can, you know, kind of send it to everyone so they can have the same thing that I'm looking at, because I feel like I kind of got like an advantage a little bit because I'm a repeater, because I see on you have put under respiratory drugs inhaler instructions, but she went into details and said patient teaching inhalers all types, and also went into details with the peak action of rapid, regular, and NPH insulins. So I wanted to know if I can at least just let you see it first, and then if you feel like it'll benefit, then.
So when we talk about, see, the problem is but yes, send that to me, absolutely, because she may have, I don't know if that was the practice HESI or if that was the HESI final.
And I see that the meds, I remember the meds that were on the practice HESI was kind of like a duplicate to the actual HESI.
They are very similar, they are, and it just depends. But so please send me that and I'll be happy to disseminate that, not a problem. So, and I want to spend a good hour going over the HESI practice prep. So that's what I'm going to do right now as well. So if you can do me a favor, DeQuisha, while I'm talking, can you send, is there a possibility to email that to me right now?
Yes, ma'am.
Perfect.
Okay.
Perfect. That'll be good. But yeah, you're right. We have different things that, you know, that we hone in on. So let's go over that. And when you send it to me, let me know when you sent it. And I can utilize that as well today.
Oh,
So,
okay.
perfect. Now, I was going to do a couple of dosage count questions with you guys as well. So, without further ado, let's see. How was your weekend, everybody? How's it been? Let me ask while I'm trying to find the information that I want to find. How are you feeling? I hear that there was some issues. I think you had a conversation with the DON and there was some issues. Are you guys feeling a little better, or are you doing okay?
I was
I think
busy
we
with
got a little bit of
EAQs, so I
anxiety
didn't have time to think about any of that.
Some anxiety. I heard the word anxiety. What was the other things? Nothing else?
I think more of
Busy
it's
reacting
just being a
EAQs.
shift.
I'm sorry,
He
Victor.
said busy working EAQs.
EAQs. What is there a problem with EAQs or?
No. He was saying this weekend they were doing busy work in EAQs.
Yes. And, here's the thing. Let me just tell you, I've been doing a lot of one-on-ones, not with this group only, but with transitions, which are term 7. And one of the big questions I ask is, especially the people who are doing well, I'm like, what is it that you're doing? What do you do? And I get different things, feedback. A lot of them use the NCLEX to help them. They use that NCLEX prep. Looking at rationales, looking at the concepts. Other feedback is in reading the book, really reading the book, using the questions at the end of the book, using these review questions, looking at concepts, whatever the key concepts are, they tie that in the book. Or remember I said your objectives for the term in your syllabus. I think I recall saying, looking at those concepts there and tying them in. Those types of things seem to work well for them. And that takes time to learn what's going to work for you, of course. The other thing that helped people a lot are EAQs, and that's why I'm bringing it up. And some of the people that did very well in Farm last term in 2 separate classes, so it wasn't the same class, they tended to do the EAQs, but then go to a higher level. They didn't stay at novice, they just decided to go at a higher level. Daquisha, you got something to add in on this? Maybe not. Hello, Mercedes. No?
I also think it's the information. Some chapters in Farm are easier than others to grasp and get like for me last exam was very easy for me because I was able to grasp it. But I'm not gonna lie, the endocrine system has always been a hard subject for me because it's insulin and all of that, the way it works, it's kind of hard to grasp on it. So I think it also has to do with the way the information, like what is the information, like cranial nerves, that's always been hard. Endocrine system is hard, but I think it just depends on the subject of the chapter. And then
the point. Yeah.
Mm-hmm.
Whereas I love endocrine, I find it fascinating. So, all right. So let's, okay. So what I want to do is some of the questions that I want to go over are related to, there's 55 questions, right? And some of them are going to be things you've heard of and some of them are not. Now, talking of insulin is going to be on the HESI for sure. Regular insulin. What did we say about regular insulin? It's the only one that can be used IV, for instance, and you need to know when it peaks. The reason being is because safe administration. You don't want to risk a patient becoming hypoglycemic, right? So you got to know when that peak is within 30 minutes to make sure that they're eating, those types of things. It could be understanding how to give the injection, that you're going to give it subcutaneously, all right? And how. We talked a little bit about sub-Q, how you would give that injection, whether you would give it at a 90 degrees or a 45. So I'm not sure what they're going to ask, but it talks about regular insulin and peak action. So I would think it's more to do with patient teaching and understanding that you're teaching the patient when it peaks and when they've got to eat, things like that. But it could also be making sure they know how to administer the insulin, all right? Lasix, one of the things it can cause is cramps. So understanding, again, patient teaching, knowing some of the things. Now think about it, Lasix, what are we doing? We're pulling urine off, right? So it's going to pull those electrolytes with it. It's going to pull some sodium with it, things of that nature. So it could be that you've got to make sure that the patient replaces their electrolytes because it could relate to cramps related to that. So just be aware of those types of things. There's going to be some GI questions on there. Misoprostol, for instance, is often used as a GI med, but there are some safety concerns with it. And if you remember, I said it's pregnancy category X. That means if the patient is pregnant or breastfeeding, you're not going to give this particular med. Now, I don't expect you to know that yet because we haven't gone over it, but it is on the HESI practice.
What med was that?
Misoprostol, and it's on that list. Misoprostol. And as I say, if you look through the big long list that I gave you with some of the scenarios, that was one of the things. And I don't mind today if this is all we end up doing, and then Wednesday we do lecture. That's, you know, and I want to utilize this time for the HESI prep, quite frankly, and a little bit of dosage count. All right. So Orlistat. Orlistat is another GI. It actually helps bind fat, by the way. So it can have some side effects to it. So Orlistat is a medication that has come up. And unfortunately, all my HESI prep stuff is at the school. But anyway, Orlistat, ORLISTAT. So if someone wants to look that one up while I'm talking, and we can talk about that one. Orlistat side effects. Okay. We're going to talk about NSAIDs, actually, and, you know, anti-inflammatories. But the big issue with NSAIDs is what? GI issues, right? Gut issues, ulcers. That's a big issue with them. But NSAIDs get used. They're over the counter. People don't realize the issues with NSAIDs. But I would say they have great effect, anti-inflammatories, and we are going to talk about that. But of course, there's a few issues with them, like allergies, of course. Remember, aspirin is also classed as an NSAID. So big problem with GI, with bleeding. That's a big issue with it. Can have other issues as well. Another big issue is NSAIDs are not to be used like ibuprofen. You're not to give them to cardiac patients. And we're going to get into that. But anyway, you do need to know basic care of giving an NSAID. How many grams can we give safely, those types of things. And as I say, I'm going to try and cover that chapter today. We've got till 3 o'clock. So hopefully I can get that chapter done. Calcitriol is an endocrine drug. Remember, it's got Ca, calcium. So do you think it might have an effect on calcium? Yes, it does. So calcitriol is a drug that is an endocrine drug. And I think we did touch on calcitriol. But what I'm going to do is get you guys, let me see if I can find it for you. Excuse me. Can't find it off the top of my head. But anyway, calcitriol is one of the drugs that I want you to be aware of. Somebody look that up while I'm talking. The 9 rights of medication administration. Make sure you know it. What is safe administration? Okay. Let's see what else. Lamisil. Lamisil is a medication. Remember that? I think we talked about Lamisil a little bit, but maybe we didn't. But anyway, one of the big issues with that, contraindications, you've got to check your liver enzymes with that particular med. All right, Lamisil. So Lamisil and contraindications. Has anybody looked up for me yet, Miss Apostle? Anybody? What does it say?
And I got to find it first. I got it on the chart. What does it fall under?
Well, it's a GI med, and it actually helps with the gastric. I'd have to have a look. I haven't got to GI yet, so for me to flip through quickly, but I could probably do it. But it is a GI med, but it's pregnancy category X.
Oh, well, I don't have that one.
I don't recall ever using it myself, but I don't particularly work in GI, so. But you have that one?
Ms. Fletcher?
Yeah.
I found the Orlistat.
Good. Tell me about Orlistat.
Yeah, it works on the fat, suppresses appetite as well.
Yeah, that's what it's for. It's actually for weight reduction, right?
Yeah.
Yeah, but because it's pulling the fat, you can get fatty stools, those types of things. So, it is something to be aware of, but it does get used. It's really for weight reduction. But as I say, it's going to pull that fat with it.
Yes.
So just be aware of the side effects of that. What does it say for side effects?
Side effects. It says oily spotting.
It says what?
Oily spotting and fecal.
Oily spotting, yeah, because it's pulling fat.
Yeah.
And I also have, I'm sorry.
No, you're fine.
For Orlistat is side effects is headaches, dizziness, fatty or oily stool, gingival disorders, or irregular menstrual. There
you go. So it has quite a few side effects. So I would definitely look that one up. All right. Really, it could be to do with nutrition, because if you're pulling out the fat, you still need your fats, right? So we don't want our patient to be malnourished. And it could be as well with that gingival issue. So it could be a couple of things. So just be aware of those. And then if somebody can find misoprostol, it is in there. It's under a couple of areas. It's also under, I want to say, female hormone pieces. I think it's under that area too. So it's under a few areas, a few different areas. So, but anyway, calcitriol, if somebody can look that while we're looking these things up. Verapamil, cardiac drug.
I have calcitriol.
Calcitriol?
Calcitriol. Yes,
Good.
ma'am.
What you got?
It's used for patients that have bone deficiency.
So
It gives.
Helps to replace calcium, right?
Yes, ma'am.
So it's, you know, think about it with these patients that don't have, they're maybe on bisphosphonates, something like that, which also are helping with the bone health. But just even if you don't know anything about it, think calcium. So think calcium and bones. It's helping with that bone health, right? Yes, Tiffany, what you got?
Are you still looking for misoprostol?
Yeah, what you got?
I got it on page 535. I know they're talking about how it helps with like childbirth and oxytocin.
It does. It does help. Well,
Not
on
really.
lower doses.
Yeah.
Yeah. Again, it's one of those dodgy ones because it is an abortive med as well. So I think it depends on the dose with that. But the concern with it, of course, if it's used for something like the GI, is the risk of abortive tendency with this particular med. So I'm wondering if that's where they're going with that. And as I say, I have seen it somewhere else, and I will find it for you. I think I maybe put it on my list. Pardon?
That's what it's stating. It's saying that it induces abortion and is with synthetic prostaglandins.
Yeah, I think it's what's called a prostaglandin medication, and that's sometimes helpful in the GI tract. So that's where that comes from, utilizing it for that. All right, so verapamil, cardiac drug, right? What do you think that might be used for? I think we talked about that. Anybody?
For verapamil, I don't know if it's a calcium channel blocker.
It is.
But it lowers the heart rate and the blood pressure. And I just put hold in bold letters if the blood pressure is less than 100 and the heart rate is less than 60.
Yeah. Yeah. So, you know, making sure that we do safe care, right? Because that's what it's really talking about with this particular med, safe administration. Hey, Andre.
Yeah, I had a question. The first time we used the word abortive was with a headache, and we used it in the context of eliminating the headache.
For migraines?
Yeah. Are we
Yeah.
using this in the different term, like abortive as in it causes abortion?
Yes, you're
Okay.
absolutely right. And that's,
Wh-
those are the terms that they use for migraines, and it is unusual, I think, as well to use those terms, but you're correct. So it's a different, very different terminology. But yes, it's with this particular med, that misoprostol, it is a abortive med in the sense of an abortion. So that's why you have to be really careful with that particular medication. Thank you for clarifying that, though. All right. So the next one I have on my list is abandronate, which is those biphosphonates. These are the meds that get used for people that have osteoporosis. And they say, I don't have it's really frustrating because I don't have my cheat sheets with me at all because they're all at the school, which is frustrating, but it is what it is. But anyway, one of the things you've got to be careful with this type of med is making sure the patient sits up. I always say if they can't walk and they can't talk, then they're not getting this med, because it can cause a couple of things. It can actually get stuck in the esophagus. So they've got to be able to get up and walk, and they've got to be able to swallow when they're taking this medication. All right. So they've got to be able to move. They've got to be able to sit up and swallow and stay up. I want to say for a good hour or something like that, or at least half an hour. So this particular med, that's something to be aware about, or any biphosphonates. That's something that if it has Hydronate at the end, that's what it's talking about, any of those biphosphonates. Yes, Mercedes?
What was the name of the drug? Adrenaline? Was it?
Ibandronate. I think all of these I put on the on your thing. Let me just pull it up. I put it all on your announcement list, right?
Okay, I can go back and look at it.
Let me check though. I'm going right now to check.
Yes, it falls under musculoskeletal.
Yep. Let me see. HESI Practice Study Guide. Yep, I put them all here.
Okay.
And I
Thank
put
you.
the areas. And some of them I've put page numbers on. Right? Yeah, so let me just show you in case you don't know what I'm talking about. So, yeah, put them all here for you all. William, did you have a question? No.
No, I didn't.
Okay. All right. Let's see. Let me get out of here. Trying to find my notes. Give me a second. Okay. Let's go on a little bit more. Prevacid. Prevacid is a medication that's used for GERD, which is reflux. Okay, so there are certain things that you want to teach with this particular med. It's not to be used long term. PPIs are not to be used long term. So that's one of the teaching pieces. I don't know if that's what you've got on your list, Daquisha.
No, I actually didn't have anything there.
Ah, all right. That's what I'm saying. So there's different things that will crop up. All right. Let's look at a couple of others. Tetracycline. Tetracycline, we're actually going to talk about this week. It's an antibiotic. One of the problems with tetracycline is it binds to calcium. So you have to be careful of the age of the patients that you give this to. You can't give it to young children because it will gray their teeth. Also, lactating mothers that are breastfeeding, you can't give it to as well for the fetus. Okay. Atorvastatin. Well, we talked about statins. What are statins?
Cholesterol meds.
Yeah. So if it's a question that comes up about diet and teaching, it could be making sure that although they're taking this medication for as a statin, that they also understand that their diet is important, right? They've got to make some dietary changes as well.
Yeah.
Okay. Labetalol, it's a LOL. What's a LOL?
Beta blocker.
It is. And
Beta
so
blocker.
beta blockers. So sometimes we use beta blockers. We did talk about this a little for things like congestive heart failure, right? If somebody has congestive heart failure, one of the things you're going to do, they're going to do daily weights, making sure your patient understands about that weight gain and what it could look like and what the concern would be. All right. So, you know, making sure you teach them those weights, you know, anything more than 2 pounds in one day or 5 pounds in 1 week could be an issue. Ciprofloxacin, that's another antibiotic, by the way. And ciprofloxacin, the floxins, and we're going to talk about them this week. But ciprofloxacin actually has what's called a black box warning. And one of the things with ciprofloxacin, it's a great med, but I want you to make sure you look up the side effects. And one of the side effects is what's called tendon rupture. certainly the Achilles heel, tendon rupture. Also, what can happen is the QT interval can prolong on an EKG, but also look up the interactions, like certain medications, antacids, calcium, magnesium, iron, all of these types of things can reduce the drug's efficacy. So looking up the interactions with ciprofloxacin is important. Ciprofloxacin's on page 615, by the way.
And I hate to be an assistant, but I also have that it can cause severe sunburn.
Yes, well, a lot of these can. Tetracycline can too. So it can absolutely. But the two biggies are QT prolongation and also tendon rupture. But anything extra you've got, give it to us. Whatever you've got.
I also appreciate the perspective from somebody who's not taken it before.
Which bit?
I said I appreciate the perspective of someone who's taken it before the test. So
yeah, absolutely.
Yes, thank you.
So, and I'm going to put that sheet up as well, whatever we've got extra to put. So, where did I want to go next? Let me see. Yeah. Rifampin. Rifampin is used for TB as a TB med, tuberculosis. Big issue. The patient needs to be on oral contraceptives because just like a lot of let me rephrase what I want to say here. The big issue with a lot of these antibiotics is the efficacy of oral contraceptives is reduced. So what I actually wanted to say is making sure that these patients, if they're on rifampin or an antibiotic, if they're on oral contraceptives, you need to do some teaching with that, making sure that they have a backup plan. Because in fact, I think it was in the last class or one of the farm classes, she said every time that she got pregnant, it was because she was on some form of antibiotic and her birth control pills didn't work. So yeah, so patient teaching, rifampin and oral contraceptives, the efficacy is not going to be as great. The other thing is as well is B vitamins with these oral contraceptives. They need their B vitamins, but probably the teaching is going to be related to making sure they know to have a backup contraceptive along with the oral contraceptives. Do you have that one, Daquisha, on your list?
Yes, ma'am. And I also want to include that the urine color, it's orange and that's normal.
Yes. So that might be, I don't necessarily know that that's going to be on, but that's the urine and also tears can turn orange, by the way. Yeah. So you might want to add that in as well. Do you have donepezil?
What does it fall up under?
Geriatrics, neurological.
I just have the antidote for cholinergic crisis. That's it.
It is. But I don't know if that's what it's.
I don't know what the nursing problem is, but all I have is that's just the antidote.
Yeah.
What's the medication again?
Donepezil. Well, I'm wondering if it's really used for Alzheimer's as well, and I'm wondering if in this particular.
Are you saying Aricept?
Donepezil.
Is it the same as Aricept?
It's not. Well, it works similar. So, hang on a minute. Give me a second. Yeah, it's Aricept. It's Aricept. So for memory, well, it's going to upregulate acetylcholine, right? Because they don't have enough of it. So I'm just trying to think for the perspective of this question. It could be related to geriatrics. It could be related to Alzheimer's. It could be related to the type of question where the family don't realize it takes a while to take effect. And so one of the nursing issues or one of the teaching components could be, I don't know, is making sure the family understand that it takes a while. But again, too much of it could cause acetylcholine crisis, that cholinergic crisis. So remember that as well. Remember we talked about sludge. Anyone remember that? Sludge?
Yes.
Yeah. So it could be that. It's hard for me to know what it's going to mention to you.
Does this medication have a time limit on when it works?
It takes a few weeks to take effect.
Okay, got it. Thank you.
Could take a couple of months to take effect. All right, couple of other things now. Oseltamivir, which is Tamiflu, by the way. And it could be, remember, we talked about that if the patient comes in 3 days afterwards and says, hey, I want that Tamiflu, you can't give it then. But Tamiflu or Oseltamivir, that's what it's for. It's for the flu, okay? Antitussives, what could those be used for? Anybody remember what antitussives are?
Do they suppress the cough?
Yes, they do. Do you have that one, Daquisha?
I'm trying to look for that one now. No,
Aren't you glad we're doing this, guys?
What happened?
What'd you say, Dr. Fletcher?
Aren't you glad we're doing this?
Yes.
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 Yeah. You don't know if you have it?
No, I don't have that one.
You don't have that one. Yes, that's what I'm saying. You just never know. But the majority of these types of things are going to come up, I promise you. All right, let's see. What else we got here? Glucosamine came up. What do you think glucosamine gets used for?
Glucose?
Nope.
I swear I have on my chart just say OA, but what does that mean?
Yeah. So glucosamine is actually a supplement, and it is used for osteoarthritis. So bear in mind that a lot of patients, don't necessarily want to go for meds for osteoarthritis. They may want to use something like glucosamine. Now, glucosamine, it's one of those herbs, how they do herbs and supplements and things like that. Look it up. Somebody do me a favor and look it up, because I want to say that, and I'm looking up myself for you to try and see if there's any issue. But sometimes, here it is. This is why I wanted to look it up for you. Just be aware that, and actually the reason I'm looking it up is because it's in that anti-inflammatory chapter, glucosamine, herbs and dietary supplements. The issue is with glucosamine, it can have an interaction with warfarin, with anticoagulants, okay? And so it could be, and also it can cause an insulin resistance. So it can have an effect on blood sugar meds and also warfarin. I knew that there was a ding, ding, ding in there for me. So it could enhance the effect of warfarin. So basically, that could be a problem. It could make you bleed more. All right? So put that.
glutamine, glutamine and glucosamine.
Glucosamine.
Okay, got it.
Glucosamine. And glucosamine is actually on page 688 in a big box there. Glucosamine. Okay. Oxybutynin, which is for the bladder, right? It's one of those alpha blockers from way back. I feel like we talked about that a long time ago, didn't we?
Yes.
Those guys, oxybutynin, those types of meds. But yeah, it works on the bladder.
And I have it on the list from Silva, and it's just asking the use and the indications.
Yeah.
And I'm trying to find it now.
It's for bladder spasms. It's to help with the bladder. And I'm trying to look at the, actually I think it's the, I can't remember, it's cholinergics or cholinergic blocker. It's probably cholinergic blocker. I think it's cholinergic blocker. If anybody gets there quicker than me. Yep, it's a cholinergic blocker. Okay. So, but it works on the bladder. It's an antispasmodic for the bladder. So it's great, it's great if somebody has an overactive bladder. So ignore me. But anyway, if you want it, it's on page 327. Cholinergic blocker. All right, moving on. But anyway, teaching of the side effects of that would be important because somebody who has acute glaucoma should not be using this, by the way. So bear in mind some of the side effects that could occur with these cholinergic. It could cause blurred vision, right? It's a cholinergic blocker, so it's going to dry everything up. So it could make them have that sensation of dryness, constipation, things like that. So think of your cholinergic blockers because that's where it's at. Because it does talk about side effects. All right, adrenocorticotropic hormones. All right. Anytime you're giving any of these type of medications, steroid meds, remember we talked a little bit about feedback mechanism. Do you have that one there, Daquisha?
Could you repeat that one?
Mm-hmm. Adrenocorticotropic hormones. It may just say ACTH.
I have it on your list, but not this one.
Okay. So the bottom line is it's probably going to ask about tapering the dose. Remember with these meds that you don't want to just stop them abruptly because the body, the brain has to tell the gland that it's working on, hey, you need to start making some because we don't have enough going on anymore. All right. So you're going to taper the dose to give the body a chance to actually produce it again. Otherwise, the patient could go into shock of some form, all right? So tapering the dose with these types of meds. Acetaminophen. So overdoses. What type of lab values do you think would be important with acetaminophen?
Liver.
Liver?
Yeah, absolutely. So that would be your ALT and your AST. Okay, so I would suggest you be aware of, the, just be aware of safe administration of acetaminophen, okay? And what would constitute too much? I think we said like 3 grams, right? Anything over 3
I thought it
grams.
was 4 for 24 hours for
Yeah.
4,000 milligrams.
I tend to go with the 3 because of the concern with the patients that have liver issues. So yes, you can give 4, but you're creeping up there. So I say 3 is sort of in the safe zone. But yeah, ultimately you can give 4, but you have to be careful. So just be aware of that. You had a question, Daquisha? You want to say something?
Yes. What was the lab value? Not the lab values. The labs that we do for those.
Well, you know, your liver enzymes is going to be your ALT or your AS and your AST. So your liver enzymes, but of course you want to look at your kidney function. So, you know, your comprehensive, your complete metabolic panel. You want to do one of those, your comprehensive metabolic panel. You want to look at kidney function, those types of things as well. And also bear in mind, depending on who we're giving this to. So you have to look at your patient, right? In order for safe administration. Bear in mind, children and your elderly can't process these meds as easily as somebody, say, in their 20s and 30s and 40s, right? So bear in mind all of those things. All right, bronchodilators. I bet you've got a bit to do with this one, don't you? Maxair. Daquisha, do you have that?
I do have it on my list, and it just says bronchodilators in the management of asthma, but I didn't put anything next to that one.
Okay, so let's just talk about that for a second. We're looking at albuterol, right? So making sure, of course, that you remember that albuterol is the one that you give first. So it doesn't matter what else, you want to give your albuterol first, because that's going to open up the airways so that your steroid can then go in and reduce inflammation. Makes sense, doesn't it? That's how you want to do it. But there's a lot of teaching. You want to make sure, of course, if it's a steroid, that they're rinsing their mouth to reduce fungal infections, of course. You want to make sure if they need a spacer, because some people can't do the technique properly. Do you have anything about all of that at all?
Let's see. No.
No. Okay.
No.
We did quite a bit of it in our last teaching.
I was gonna say, I think I went over it a lot
On the exam.
Right.
Yeah, you did. In the last video you gave us for an exam, we went over it a lot. So just look back at your notes, and it's a whole section that you asked us, like,
awesome.
What is it used for, and if you was taking the steroid, would it be used first or second, spacer, all of that.
Right.
And the short-term use for albuterol, and the other one was like for long-term use was
yeah,
spirulactose, something. Yeah.
Okay. So I talked about a lot of that stuff. Well, just be aware of what it is, okay? If you see Maxair, well, think about it. Maxair. All right, that might be helpful for you. So it's going to help, right? It's a beta agonist. It's a bronchodilator. So, yeah, we can just use our detective knowledge, be a detective on that one. All right. Let's look at some of the other. All right. Nitroglycerin. Nitroglycerin, remember, it comes in many different ways, doesn't it? What sort of pain does it treat? Anybody?
Heart.
Angina.
Correct.
So nitroglycerin would be NTG?
Yes.
Okay.
Yes. And so, they're going to have these nitroglycerin patches. That's more for sort of your maintenance, to more of a preventative. But of course, you've got the nitroglycerin sublingual. but they're talking about the patches potentially. So making sure for you that you wear your gloves when you're taking these things off, right? But that's what it's for. It's for angina. It's for the treatment of angina. So safe administration with that. You're going to check your pulse, right? Making sure you check their pulse and their blood pressure, all of those types of things. Safe administration.
It just says nitroglycerin transdermal patches, indications, and patient teaching.
Yeah. Okay. So look up nitroglycerin patches, making sure the patient understands to take that patch off. When they're putting the other one on, that you don't have two patches on, those types of things. Making sure that they understand that they keep the patch on, right? Nitroglycerin the patches are usually like a 72-hour type of patch. Making sure that it adheres properly to the skin. So there's lots of patient teaching around those and making sure that it's working.
Miss Fletcher, do you put the patch in the same spot every time you take it off, or you have to change it?
Move it around. Okay. Remember what I said, and I can't remember the terminology, but basically the skin gets used to something being there. So you actually want to move it around so that those skin receptors cannot become, and we talked about it, and the term has gone out of my head right now, but you want to move that patch around.
And if you guys want to include anything, I just put remove it at night and it can produce tolerance if worn 24 hours.
What? You would remove it at night?
That's what we put on the study guide, that remove it at night.
Huh.
Well, not, I guess, change it at night. I put remove it because that's what I put last time.
You want to change it. It could be, but some of these patches are 72 hours, some are 48 hours, so whatever you're going to do, change it. You wouldn't go without it at all. If it's not, if it's supposed to be every 72 hours or if it's supposed to be every day, you're going to change it, but you're going to move it around.
Okay, I think we need to read more on that, because last term I thought it was remove it at night and then that morning nurse would put it on there. I think we should all touch up on that. We should put a star next to that one.
Yeah, do me a favor, somebody, while we've got our hour and a half. Somebody look up nitroglycerin patches. It's under anti-anginal. I'm actually right there, and I'm looking at it.
I do remember
nitroglycerin. I am right there for you guys.
356.
Dr. Fletcher, after this one, I don't mean to be rude. Can we take a 10-minute break? It's a little overload. Just a little bit.
When have I not ever given you overload?
I know.
Right. Well, tell you what we'll do. At 1:30 we will take a 10-minute break.
Okay.
And in the 10-minute break, what I'd like a couple of people to do is somebody look up, I'm right there, but somebody look up about nitroglycerin patches for me.
Mm-hmm.
And I also want, that's hilarious. You guys are funny. See, I just keep going.
I'm sorry, Dr. Fletcher. I'm sorry. This is my first time.
Yeah, I'm old style. We have, we just keep going, right? The other one, look up interferon. Somebody look up interferon. And somebody look up nitroglycerin. And I tell you what, then I'll give you guys, let me give you a 10-minute break and we'll come back. Let's see. I'll give you guys let's say 15-minute break. Does that sound good? You want a 15-minute break?
Yes.
Yes, thank you.
Yes, ma'am.
You're welcome. Let me put this on hold. Are anybody back on yet?
Yes.
A few.
Yeah.
Most of you.
Yeah, I'm here.
Daquisha, you're here?
Professor DeQuisha, I'm here.
Awesome. I appreciate it. So you're my right hand man today, because that's fantastic. Isn't it helpful though, guys, having somebody else?
Yes.
Yeah, and Jordan and Monica as well. I can't tell where you are. I can see Jordan, Chaos, Monica. I think I can see you there as well. But please chime in if you've got anything to add. Like, oh gosh, I remember this, that, or the other thing, because it's very helpful, and it's helpful to me as well to be able to give information that you need. So, all right, let's do some more of this. One of the things I wanted to point out to you is first dose interferon. Now, we don't actually really cover this chapter particularly, but interferon can come up. Bear in mind that some of the questions that come up are test questions, meaning you have 55 questions, but only 50 of them are actual questions that you are graded on. The other 5 are test questions that come up to see if they're going to be test questions, okay? So interferon may come up as a question. And one of the things I want you to be aware about interferon is, they have different properties. They work as an antiviral, they're anti-tumor, and they're immunomodulators as well. So they get used for a lot of different things. They can be used for like rheumatoid arthritis, that sort of stuff. One of the things that they can cause when you give that first dose, especially adverse effects, is fever, chills. It's like a flu-like reaction. So I just want you to be aware of that for safe teaching, for teaching rather, and safe administration, that you are aware of those things. And I'm just refreshing my brain because, as I say, we don't tend to talk about interferon that much, but I did want you to be aware that it can have that type of effect. I mean, I've seen it happen. I used to give it a lot in sort of hemonc, but that sort of flu-like. I don't know if any of you had your vaccines and then had that sort of flu-like chills and all the rest of it. So that type of reaction can occur, okay? So just be aware of that. All right, moving on. Did you have that one, Daquisha, in your list?
I had it on your list, not the one that I have, but I do want to include something. It's a lot of those things, and I remember it was a question that I actually got wrong on the HESI, and it was pertaining to an elderly patient, and it was a saying in the beginning of the term, start low, go slow. And that was one of the answers. It didn't say it in those words, but it was pretty much, piggybacking off of that. But it was start low, go slow. So if you guys have anywhere on your paper, just put that to the side, elderly or the young, I guess. But it was specific to elderly. Start low, go slow.
And actually, it's in the book.
Okay.
It's actually in the book. And this is why I use the book predominantly, because everything that is on the HESI is related to the book. But start low, go slow is definitely an adage that should be used. And I can't remember where in the book it is, but it is in the book, and it's related to the elderly. I want to say it might be in the first few chapters when we were talking about, say, the Beers taxonomy, when we were discussing about, the patient will come in with a list full of meds, and it's basically this one reacts to this one, and the elderly tend to be on 50,000 different medications.
Yeah, the polypharmacy.
Yeah, polypharmacy. I think it might be in somewhere in that component, but I have seen it in here, and that is the adage that we use anyway. So thank you. All right, moving on. Let's see what else we've got. Okay. Oh, narcotics. Okay. So obviously, oh, did anybody find out about the nitroglycerin patch? Anybody look that up?
I know you have to take it off before you apply a new one.
Exactly. Yeah. So that would be, yeah, I don't see any way about keeping that patch off. I want to say it's called, I don't know if this is the correct term, and I want to find it, like tachyphylexis or something like that, is where the skin receptors basically get used to that that area, which is why you want to move it around. And that's what I teach my patients that do the bioidentical hormones. I teach them to rotate the sites around because of that. So, but anyway, let's look at some of the other things. Narcotics. Obviously, what do narcotics do? What are some of the adverse effects with narcotics?
Suppressed respiratory system.
Yeah, good one. Good one. Think your ABCs. What else? What about are you going to teach them, sedative, right? So you want to be careful. They may not realize as well the interactions of different other analgesics that they're taking. So, hey, Andre.
Slowed down GI system.
Yeah,
So
absolutely.
backed up guts and all
a lot
of
of
that.
constipation. Right. So, the nursing action, making sure that you're aware that when you give this, that that you don't sedate your patient too much, right? Or cause any other adverse effects. So bear those things in mind. It is, in this particular one, I think the concept is more to do with anesthetic and sedatives and the nursing action. So again, especially your older patient.
Well, give me nothing.
Okay, so with narcotics and opioids, are those the same thing?
I'm sorry?
With narcotics and opioids, those are the same thing? Okay, so I see that I have, okay, I didn't understand what you meant by double dose.
I don't think I've put that down, but that might be further in, so we'll get to it.
Yes, ma'am. It's on the exam 3 for the double dose. If on the video, or on the, I think it might be on the HESI study guide too.
Yeah, it's on the HESI study guide.
Yeah,
HESI study guide. Let me get to it when I get to it. I'm not there yet. So, okay. Peak and trough. Remember your peak and troughs? Remember any idea what they are? What is that even?
I think it's when your medication is at its highest and when your medication is at its lowest, the effect.
Yes.
Yeah.
Something like that.
Yeah, no, you're right. So we're looking, for potential toxicity and efficacy, aren't we? We're making sure that the medication works like it's supposed to. That's what we're doing. More often than not, you're checking the trough at the lowest level, which will be just before, you need to know this will be just before the next dose. And the peak, of course, is after the med has been given, when it's peaking. So it just depends on when the peak is on that. But the trough is always just before the next dose. So be aware of that for your IV. Hello?
Before means immediately before the next door?
Yeah, I mean, you're going to you're going to draw the trough just before you give the next dose. That makes sense?
Yes.
I mean, it might take you a few minutes to draw that one and then hang the next one. But yes, because that's going to be the lowest point, isn't it?
I looked up the nitroglycerin patch.
Why is yours?
I don't know.
Oh, I don't know, Billy. Let's see what we can do on that. Try again. Don't want to hear what you had to say.
356 and 356 and
feedback
363.
from somewhere. Wherever you are is giving you feedback.
I think he has his phone and his computer logged in at I think both of them are on Teams. I think you need to come out of one of them, Billy. I think.
Shut one of them off. Shut maybe whatever one you're not using, like the second.
I'm not on it.
Or mute it.
Yeah, welcome to the.
It helps if you have headphones on, and so it doesn't do that sometimes, but not always.
Yeah, it's really interesting, isn't it? Why it doesn't. I'm sorry, Billy. I really wanted to hear what you had to say. Try again. No.
It's not working.
Yeah.
Hey, Billy, text the group. Can we text on here?
No.
I don't know why this.
And I will ask the question for you.
Yeah.
Yeah, I don't know why the meeting chat is grayed out. That is so annoying.
He said
Okay.
NTG page 356 and 363.
Okay.
He wants to know what that means.
You mean what I've written? Okay, hang on a second. In my announcement, nitroglycerin, it's probably the page number. Hang on. Where am I? Sorry, guys, I'm trying to find my HESI information practice guide. What? I haven't put that. I don't know what he means. Sorry. I don't know what he means. Not sure. All right. Sorry, Billy. You're welcome to message me on the remind if I can be helpful.
What was the question?
I didn't really understand what the question was.
All right, Billy, now ask the question.
No, I just looked up the information. She asked where it was, and it's on page 356 and 363.
Thank you.
Okay.
Yeah, for nitroglycerin. Yeah, and I think I did say that it was there, but I didn't see anything about wearing the patch just intermittently. But all right, guys.
Excuse me.
So I'm going to move on while you guys chat.
Ms. Fletcher?
Yes.
I looked it up as well in the drug guidebook, and it does state that its duration is 12 to 24 hours, and it says apply the patch daily to a site free from hair and remove it at bedtime to provide 10 to 12 hours of nitrate-free interval to avoid tolerance.
Interesting. What book is that in?
I don't.
This is the drug guidebook.
Billy's trying to get back on.
That's in your drug guide book, right? But
yeah.
It's not in your actual. Okay.
Drug guidebook they gave us for this term.
Okay.
And I was just going by a lecture that we had. I never did actually look it up, but I do remember it being said in class to take it off at night, and that morning nurse will come in and put it on.
Interesting. It doesn't make sense to do that. Only because if it's a daily patch with an efficacy of 24 hours, I don't know why you would take it off. But that's a whole nother question. I'm just curious, you know. So unless it's only a 12-hour efficacy. So I'd be interested in that. I have to look at that. Let me move on so we can get through this. And I'm definitely going to look at that. let's look at some of the other pieces here. Lactulose. Again, this is in your GI section and we haven't talked about it, but lactulose is a medication that's used for constipation, but it actually is a great medication for patients who have cirrhosis of the liver. It's a binder and it binds ammonia. So if you're seeing it used for somebody who has cirrhosis, that's what it's being used for, okay? So just be aware that you may have somebody who has a history of alcohol abuse, who has cirrhosis of the liver, who is now on lactulose to help bind that ammonia and get it out of their body, all right? So you may see that. You're going to see some dosage calc, things like mils per hour, things of that nature. You might see converting milligrams to grams, so be aware of that. Dilaudid, what could the side effect be of Dilaudid? Remember, it's much more potent than morphine, isn't it?
Mm-hmm.
So what type of side effects are you going to see with something like Dilaudid?
Sedation. Respiratory failure.
Yeah. Yeah, absolutely. So be aware of your side effects with Dilaudid. Be aware of the fact that it is, isn't it 4 to 5 times, 5 times more, or 4 times more potent than morphine?
You have
Thought
dry
it said
mouth.
7.
I got 7.
Yeah.
Dry mouth, sweating, flushing.
Mm-hmm.
Difficulty
So,
speaking.
but safe administration because of the fact that it is so much more potent, all right? Yeah, so you don't want to make a mistake and give the wrong one.
It's on page 149.
Thank you. It's in the little box there, isn't it? About the ratio. Okay. All right, let's look at some of the others. Aspirin. What types of patients are you not going to give aspirin to?
Renal failure.
Patients that's on.
What about, yes, and what about children?
Yes.
And I was going to try and see if I can get through this chapter today. I don't know if I'm going to get through it. I might have to wait till Wednesday to get through it. But what about Ray's syndrome? Remember we talked about Ray's syndrome? Anybody remember that?
Yes.
Mm-hmm. So children with flu or flu-like symptoms or chicken pox, things like that, you're not going to give children, I want to say under the age of 8, aspirin, right? Because of the risk of Ray's syndrome with them. And, you know, if I don't get it to do it today, then I might still be able to get to do it, I'm hoping. Okay, let's see, what else have we got? Succinylcholine. Succinylcholine. Anybody remember what we use that for? Victor, anybody? Anybody?
Isn't that the drug that you for intubation?
Yeah. Yeah. But think it's got the word choline in it, right? So it's gonna, yeah. So think of all the side effects to do with that succinylcholine.
Acetylcholine, it's a neuromediator practically, so it works on neuroreceptors. That's why cholinergic receptors practically use acetylcholine to mediate, to initiate the action.
Right. So when we look at that, what are we concerned about with the side effects of that? What could be? So it creates a paralysis, doesn't it? That's a concern. So you better make sure you've got your ventilator right by close by. That's for sure.
Yeah,
Because that's what you're using it for, right? That's one of the things. because it's competing with acetylcholine receptors. So you definitely want to make sure but look under cholinergic drugs, and let me see if I can find it for you guys. Acetylcholine.
173 and 175.
Billy, you're so good at this. He finds those things really quick. 173, 175. Yes. Acetylcholine. So I would suggest, making sure you're aware of the side effects of it. Look at some of the side effects here, right? Hyperkalemia. What's that?
High potassium.
High potassium.
High potassium, right? Yeah. And that favorite that we don't tend to see a lot, but that malignant hypothermia. But anyway, some of the concerns with some of these meds you do want to just be aware of. Okay. And it's on page 175. Quick onset of action. It's really, really rapid. So acetylcholine. So bear in mind that one because it's going to come up. Well, it has come up, but the side effects of it, the safety of it, those types of things. All right, heparin. What do we use heparin for? Talked about this. It's blood thinner,
to keep blood clots from happening.
It's blood thinner. So, of course, it can create bleeding. So be aware of the nursing action. You're watching for blood in the urine, in the stool, when they're brushing their teeth, petechiae, ecchymosis, all sorts of different issues that could indicate bleeding. All right, so you're going to teach your patient about that, patient teaching. Let's see. We haven't talked about this super infection. Super infection. I think, I may have mentioned it to you, I'm not sure. But remember, has anybody ever had a UTI, urinary tract infection, and they've been given a medication for it, and then, you end up with another infection as a result of that antibiotic. Has that ever happened to anybody?
Yes.
Don't all shout at once, because I know it has.
Yes.
Right. So that's super infection. That's what we're talking about. Okay. So just be aware of that. But the anti-infective medication that's used for one bacteria, unfortunately, can suppress, say, gut bacteria and cause something else like a fungal infection. So C. diff is another one. Anyone work in the hospital environments, right? The patient's on a lot of antibiotics, and unfortunately their gut flora has been reduced, and as a result they end up with C. diff. Okay, if you haven't been introduced to C. diff, that's your welcome to nursing. It's a great smell, right?
Would MRSA be in that category as well?
Yeah, absolutely. There's a lot of them. VRE, vancomycin-resistant enterococcus. So lots of different things that, ultimately, but super infection is really as a result of getting a medication that's made to treat something and then developing another infection as a result of the body being suppressed a little bit. Okay, so that's that super infection, and we are going to be talking about that this week. Anything else? Daquisha, join in anytime. She's got the cheat sheet. Anything else so far? Did you have acetylcholine in there?
Yes, I did. It was asking for just the side effects and indications.
Okay. All right. Okay. Remember myasthenia gravis, the disease that, for some reason, they love this. this anticholinesterase. And remember, that's the enzyme, isn't it? The anticholinesterase. So using that medication that breaks down or prevents the breakdown of cholinesterase. So anticholinesterase is going to prevent the breakdown of that, and it's going to help to build up cholinesterase. Let me see if I can find that one for you. It's fairly close to the beginning. I think it's more in the, let me see if I can find that. Cholinesterase.
Is myasthenia gravis this uncontrollable muscle? Is that what this one is?
Yes.
Some
And then they
type
have
of-
difficulty swallowing, all of those things. So cholinesterase breaks down acetylcholine. And so anticholinesterase is preventing that. So they have more of the acetylcholine on board. So just be aware of this anticholinesterase. And I'm actually on page 174. For some reason, I was fortunate enough to find it for you guys. But that's one of the anticholinesterase.
And it said anticholinesterase trial for diagnosing myasthenia gravis.
Correct. So that's what these drugs, and I don't know if it's actually going to give you a drug or whether it's just going to say anticholinesterase. But remember, we talked about that a little bit, that they'll give this anticholinesterase to see if the patient will actually build up acetylcholine and feel a bit better. And that's a way of diagnosing myasthenia gravis. Okay, so that's a biggie, that one right there. Let's see. Inhaler instructions. I think we've talked about that a lot. I don't think I need to go over that too much, right? You've pretty much said, yeah, you got it on that. Penicillin. And it may just say PCN. By the way, that stands for penicillin. Bear in mind, it can cause anaphylaxis, right? So people can have an anaphylactic reaction to penicillin. So, you know, obviously, if you don't know if somebody's going to end up with it, I don't quite know what this question's asking. It's talking about IV meds. It could be, you know, making sure that you take a good health history, get their allergy list. I'm not sure what it's asking. Do you have anything to add on that, Decretia?
I have PCN and signs and symptoms of anaphylaxis.
Okay, it doesn't really say that there. So it is talking about med administration, and it is talking about IV meds and safe administration. So I don't know. Yes, you want to be aware, of course, of the signs and symptoms of anaphylaxis. But as well, you know, you're going to shut that IV off, right? If you started an IV of penicillin and the patient starts to get short of breath, can't breathe, lip swelling, all of that, you're not going to keep that med going. You're going to shut that thing off. So it could be something along those lines.
And I think that it was asking if I could remember, what do you do? And it was contact the healthcare providers, stop it. I don't know exactly what it was asking, but I do know that it was of those choices.
Yeah. I mean, you can go ahead and just stop the infusion while you're calling.
Okay.
Do both. So, but I don't, you know, these questions are worded sometimes weird, but you know, if it's to do with IV meds and safe administration, you definitely want to shut that thing off.
And I think that's where I got confused because I didn't know which one was the best one, and it had that choice, but I didn't know if I needed to contact someone first or immediately stop it.
I would immediately stop it.
Okay.
And then just tell someone to go call.
Okay.
Because you don't want to, I mean, you don't want to keep that thing going, right? Logically. So that's what I'm saying. Sometimes you just have to sort of be logical in how you're thinking. I mean, let's put yourself in the place of a patient. This is happening to you and you're like, oh my gosh, turn that thing off. Right? That's what I would be thinking. Susie Lee.
Oh yeah, I was gonna ask for the penicillin, would it be like patients that are allergic to like Cipro drugs or stuff like that?
Say that again.
Like the Cipro drugs, like
Yeah, yeah, well, yeah, any antibiotic, anything really, but in this particular instance, they're talking about penicillin. So I'm thinking it's probably what order would you go in, you know? And think about it, the things of what you can do without an order, right?
Yeah.
You don't need an order to shut that med off.
No.
So you can do that first. Okay, let's look at some of these other things. All right, carbidopa, levodopa toxicity, too much dopamine. Too much dopamine. All right, so bear that one in mind. Hey, Juliana. Hello. You had a question?
No.
Oh, okay, good. Do you have anything else for me, Daquisha, on that one? Carbidopa, levodopa?
Not that I know of. I just have, I don't see it on this paper, but I'm sure it's there. But I do have next to that is toxicity. Expectations is lessening of tremors and Parkinson's disease. And adverse effects is impaired voluntary movements.
Yeah. So remember what we're doing here. Basically, we're giving more dopamine, but we're actually, you know, we are. I'm actually on it right here. It's on page 238. So if you want that carbidopa, levodopa, adverse effects is there. Dysrhythmias, hypotension, muscle cramps, GI distress, things like that, okay? So we don't want too much of that. All right, let's see. Ginkgo comes up with as a herb. So I would suggest you look up the herb ginkgo. I told you a lot of these herbs come up. Okay, so sort of reactions that ginkgo can create, or the interactions. Baclofen.
Can we go back to ginkgo? I have on my study guide from last term, it's just asking the side effects and uses, and I just put memory loss, side effects, GI upset, headache, and risk for bleeding. Stop using prior to surgery.
That's great. I'm looking, it probably is in the area to do with possibly a near anti-Parkinson's. So I was looking to see maybe if it was in this area with Alzheimer's, but I don't see it. But my suggestion with the carbidopa, levodopa guys is there's a lot of patient teaching component about that. And it's on page 240 and 241. So I would suggest you really look at that for sure. And let me just see if I can see anything with ginkgo.
If it helps you, I remember carbidopa and levodopa by You Can't Leave Without the Car, if it helps anybody.
Yeah, that's good. I like that. Okay. Let's look at some of these others. But if anyone can find ginkgo, I know William's like the
208 and 319.
Thank you. I knew he would find it. That's awesome.
Yeah, 319. Yeah.
208. Excellent. There it is in a little box. I appreciate that. So look at the side effects there. Ginkgo and ginseng, by the way, both of those two come up. So let's look at a couple of other things. Baclofen. bear in mind, baclofen is used for spasticity, okay? So, you know, just be aware of what baclofen is for. And it should help with that mobility piece. It should help reduce spasticity, okay? Do you have anything else on that one?
Yeah, question, don't they use baclofen also for pain?
You can. There are patients that take it for instance, they have it in like a pain pump, you know, a baclofen pain pump, like actually it's an actual pump that they put in. So yes, you're right. Yeah. I'm sorry, what were you saying to Quisha as well?
I have that on your list, but not Silva's. What was the patient teaching on that again?
Probably the side effects. So I would have to look up what the patient teaching would be. But as I say, it's an antispasmodic. And if I can find it, I'm actually in, I would think, let's see, it's probably under muscle relaxants. Might be in this area with muscle relaxants, something like that.
191.
Did you find it? Baclofen. Yeah, 191. Thank you. I found it. Yeah. So let's see. Yeah, adverse effects, a sedative. It can have a sedative type of effect. Okay. So, you know, if you're getting that patient up to walk and mobilize and they're feeling a bit better, just be aware it has that sedative effect. So risk for falls, those types of things. So definitely look confusion, drowsiness, all of that. Okay. And there's a lot of side effects, but that would be one of the things. Muscle weakness. So because it's reducing that spasticity, so it can, of course, have the opposite effect. All right, glucagon. We talked about this with diabetes. I showed you that little kit, right? The glucagon pen. Bear in mind when you would use this, if your patient's awake, you're not going to use it. But if your patient is not conscious and they need the glucagon, you better roll them on their side. You don't want them aspirating because they may vomit with glucagon. Okay. Okay. Safe administration again, your 9 rights. The double dose of opioid, the question is related maybe to ethical, legal, and documentation. So it could be, and this is just that you gave a double dose and you didn't document it and you didn't do a, you didn't do the appropriate things that you were supposed to do with that patient. I don't know what that question is, but it's talking about safety, legal, ethical, and documentation. So it could be that you didn't do a, I forgot what they call, but the sheets that you do that don't go in the chart to show that you actually made a med error, something of that nature. So could be like that. What were you going to say, Susie?
Oh, no, I didn't say anything.
You weren't saying anything. Do you have anything about that, DeQuisha, or is that what you're wondering about?
That's what I was wondering about.
I think it's probably to do with that. So I think it's probably going to be fairly self-explanatory, but, obviously if you give 2 doses of any med, it's a med error and it's an ethical issue. So I'm not sure what that question's asking. All right, Carafate. It's a GI pill. It's a pretty big pill. We basically call it like the gastric Band-Aid because it creates like a nice sort of slurry. So when the patient takes it orally, it can coat the area, say they've got an ulcer, gastric ulcer. So it's actually like a GI Band-Aid. So just know what Carafate is, making sure the patient swallows it fairly quickly. Sometimes these go down nasogastric tubes and they can clog fairly easily, okay? So making sure they drink plenty of water, that they sit up when they drink this stuff, sort of similar to the biphosphonate thing. But anyway, Carafate, it's a GI med, so I would suggest you look that up. Also look up your antacids, just as an aside, understand what antacids do. I mean, what do you think they do?
For GERD, like Prevacid. Or
Yeah,
Prevacid.
yeah, they block the acid.
Change the pH of the gut.
Yes. Now with PPIs, we really don't want people to be on PPIs long term, usually between 8 to 12 weeks, something like that, because we really don't want to stop that hydrochloric acid long term, but that's what these do. Okay, here's one that you won't have, well, you may have heard of it, Premarin. It's in your Women's Health, Premarin. It's actually derived from horse urine. That's why it's called Premaire, French term for horse, by the way. And it is a estrogen supplement, and I can't stand it. I would never put a woman on it, but that's just me. Anyway, it's for hormone replacement therapy, and I use that term loosely. I don't care that this is being recorded. The bottom line is if anyone's on Premarin, they shouldn't be. That's what I think. But it's in there. And look at the side effects, please. Adverse effects of Premarin. Let me see if I can find it for you. It's in the Women's Health component, and probably Billy will find it quicker than me. But if you look at conjugated estrogens, you will see about it. Anyway, it's oral estrogen, and the bottom line is it causes clots. You know, it causes the body to be clotty, so it can cause hyperplasia of the uterus. It creates a risk of endometrial cancer. There's lots of risks with this particular med, but I don't even know if they... By the way, calcitonin, if you want it, is on page 533. 533. The big issue with calcitonin, and this is what's been on the HESI as well, it's made out of fish. It's made out of salmon eggs, I think, or it's derived from salmon. And be aware if your patient is allergic to fish, okay? So just be aware of that. And yeah, I don't even see Premarin in here. I think the only time it's indicated or used or talked about is in one of those tiny little purple bars, but it's in the women's section. Okay, a couple of others I want to talk about. Pilocarpine. Well, what's pilocarpine? We talked about pilocarpine. Anybody remember?
To dilate the eyes?
Mm-hmm. It's an eye drop, right?
Yes.
Yeah. So I want you to know about pilocarpine and evaluating it, making sure you know what that does. It's on, and I'm trying to look as we talk about it right here. Give me a second. On page 886. What it can be used for that, but what does it actually do as well? It doesn't dilate, it does the opposite. I'm sorry, Dequacia.
Pupils.
It actually is used for glaucoma, and it's a miotic, and I think I put that in my cheat sheet for you.
Yeah.
Okay, and the reason I did that is so that you remember it's not for dilating, it's the opposite. It's going to constrict the pupil. So it's actually for glaucoma. So be aware of what it's for. Is it, and if you're evaluating it, does it work? Is it working for that patient? Hopefully. Okay. Okay. Antipsychotic meds, foot tap. Remember I said with psychotic patients, part of the issue, they think, one of the theories, is too much dopamine. So by blocking that effect, by blocking a little bit of dopamine, the problem is with it is that they can have these sort of bizarre affects, a little bit looking like the Parkinson patient with the, the cogwheel walking and all sorts of strange affects. And one of the affects is this foot tapping. Okay.
What drug is that?
It doesn't say, but just generally speaking, antipsychotics. That's the thinking behind it, that you're reducing your dopamine. And so they end up getting these strange sort of affects.
Would we refer to those as extrapyramidal effects?
You could, yes. Absolutely. But it specifically is talking about a foot tap. Now, on another HESI, there's another term as well. I want to say akathisia or something like that, where they have a sort of strange head affect. So anyway, so some of those. So just bear that in mind. Let's see. A couple of others. Okay. Doxazocin. Now that's your alpha blocker. That's your alpha blocker right there. Used for BPH, things like that. So let's see the side effects. So the side effects of an alpha blocker is what you need to know. Okay. So nursing teaching of those. It's used for blood pressure as well, but it's used a lot for things like BPH. Okay. And then let's see, lithium toxicity. So remember we do those levels, don't we? Now, I don't know what that question is going to ask. Do you have anything, Daquisha, on that?
It just says review the levels and signs and symptoms.
Yeah. Yeah. Lithium. Definitely know that. Okay. Let's see. I think there's one more. There's one more here, and we don't really talk about it that much, but I'm gonna, it's called Foslow. Well, what do you think that might do? All right, it controls phosphate, by the way. It's used for patients that are on dialysis, that have got severe kidney disease, Foslow. So, it just controls the level of phosphate in the blood. It prevents high phosphorus in the blood. So pretty self-explanatory type of med, but even so. All right, so we did a lot here, right? Was that helpful?
Yes.
Oh. Yeah?
Yeah, very much.
Okay, so with the last half hour, we can do one of two things. We can do a tiny bit of dosage calc if I can get a I can usually get, that's so weird. I'm looking to see if I can get the whiteboard. Let's see if I can, whiteboard, okay.
Can we mention about metformin? And on this paper it just says metformin and the interactions with contrast dye.
Well, that may have been on that one. It's not on this one, but we did talk about that. Remember metformin? You have to be, do you guys remember us talking about that, about metformin and making sure you stop the med a day before and 2 days afterwards, right? For any type of, if they're going for a procedure that incorporates a dye. Does anyone remember that?
Yes.
Okay. So, you know what I'm going to do on Wednesday, we're going to go over antibiotics, but you have those antibiotic lectures. So between now and then, because you're all off tomorrow, you can actually listen to those antibiotic lectures, which will prep you. And I'm also going to talk about chapter 44 on Wednesday, which will be the non-steroidal, and we're going to do a little bit of what I wanted to do today, which was some group work. So we will do that on Wednesday. And in the meantime, you, as I say, do you know where those lectures are? Does everybody know? They're on the announcements. Do I need to show you? I'll show you.
Are you talking about the ones in modules, or do you have different ones in?
They're in the announcements. I'll show you all before the class is up. So I think that's what I'll do. And as I say, there's lectures about antibiotics, but I'm not sure how much information is there. There's about at least two lectures. I think about 6 hours of antibiotic lectures, I think.
It's 2 lectures on it.
Have you listened to them?
I started one of them.
And you got bored and fell asleep or something?
Well, no, I just, I didn't get bored. But yeah, there's 2 of them.
Okay. But my point is they're there. So I would suggest you listen to them. They're in the announcements. If you scroll down, they're YouTube videos, or I think you can probably go to YouTube, they're public videos, but if you just scroll down in the announcements, they're there. So I thought we would do a couple of dosage calc, and you know what, it's got it that only I want to edit, but I'm going to put that you guys can edit as well and participate in this. So let's make this bigger. Okay, let's use a red pen. All right, give me a second. I'm going to pull something up for you. I'm going to pull up 2 questions, 2 dosage calc questions, so you can see them. And I'll go from there. Can any of you see the whiteboard yet? Can you guys see it?
No, not yet.
No? Oh.
No.
Oh, grief. Great. Okay. So you can't see this whiteboard at all. Wow.
It just says whiteboard in process.
Hang on a minute. Can you see it now? No, that doesn't.
Oh, now we see something.
No. Can you, hang on. Nope, that's not it. Oh. Okay, it disappeared on me. All right, well let's just do what I want to do, and we'll do it differently instead. Give me a second. I have a mils per hour question for you guys, and I'm going to show it to you. Okay, can you see this?
Yes.
Okay, perfect. All right, so can you see this question here? This one right here, where it says the physician has ordered a lidocaine drip 2 milligrams per minute. Can you see that?
Yes.
All right.
It's very hard to read. I don't know.
Oh, it's hard to read. I don't think I can make it any bigger.
You can zoom in on your own computer to make it bigger.
Let's see.
It's a short one. The physician has ordered 2 milligrams per minute for a patient. The lidocaine concentration is 2 grams over 250 milliliters in water. How many milliliters per hour should the lidocaine be infused?
Mm-hmm. So why don't we do this as a group? And let's see if I can. I want to use the white screen is what I want to do. Whiteboard. So right now you're not seeing this whiteboard at all.
It's loading something.
I see the whiteboard.
Me too.
Okay.
On mine, it says that for now, only members of this organization can participate. Soon you'll be able to, but nothing comes up.
All right. Well, hey, this is going to be recorded, right? So we can
see, I can write on it. Oops.
Right. So why don't you do that, Ariel? You're going to be my scribe.
Okay.
All right. Pick up color.
All right.
So the question is, we have a lidocaine drip. The order, the order is, so if you, I don't know if you want to type, you can type, by the way, as well. You can type if you want to type it.
Oh, I got to figure out how to type
I'll do it. I don't know if we'll have enough time. I know, it's fun, right? Okay, the order is, I'm just going to put it here. It's a drip and the dosing is 2 milligrams per minute. Okay? The concentration is 2 grams in 250 mils. I'm paraphrasing a lot. And so it's looking for mils per hour. So that's what we want. So, Ariel, over to you. Pick a thingy. Pick a color or however you want to do it.
Uh-huh. Oh no. I don't know what.
You want me to do it?
Yeah, because it's not where it won't let me pick up. It won't let me get off the. It won't let me.
It won't let you pick something. Okay. All right. It should, because maybe you have to click off it and click back on or something. I don't know. All right. So what are we looking for? We're looking for, excuse my terrible writing on this thing, mils per hour, right?
Yes.
What have we got? Anything? Do we have anything that has mils in it?
250.
2 mils.
What's the relationship? What have we got that's got, what's with it?
2 grams.
Yes. Sorry, I suppose I could do typing it, but all right. So this is 2 grams, isn't it? Whoops. So what would be next?
2 milligrams per minute.
Mm-hmm. Hang on a minute. So well, you could do that. Let's do that. 2 milligrams a minute. Do we want that?
No.
What do we want?
Mils per hour.
Mils per hour.
So we want hours. So how are you going to get how are you going to get to what you want?
60 minutes, 1 hour.
Mm-hmm. Sorry about this. And then there's another piece missing.
Hour.
Gram to milligram.
Yes. So what are you going to put there or here?
2000 milligram.
How many grams? How many milligrams in a gram?
1000.
So we want to get rid of this, correct? So the only way I can really get rid of it is I need to get rid of my grams and I need to get rid of my milligrams. Sorry. I don't know if I can make this bigger. No. So the bottom line is we want mils per hour. That's all we want. I don't want grams. I don't want milligrams. I don't want minutes. I don't want any of those things. So I have to get rid of them. So the only way I can do it is something like this format. So let me use a different color. So and then believe it or not, that's a milligram. So if you multiplied across the top, you're going to have 250 multiplied by 2, multiplied by 60, multiplied by 1. What is that?
Isn't it 30,000?
Yes. Wow. This is hard to do, folks. And then what would be on the bottom?
It would be
Yeah.
2000.
2,000.
What's the answer?
15 minutes per hour.
50,000.
15 mLs per hour.
Okay. And let's just make sure we were correct. Let me show you. Okay. So it was correct. All right. Okay. So the next one is a little bit more complicated. And if anybody is able to use the whiteboard, that would be great. But at least, hey, it's recorded, so, you know, you'll be able to see it. Let's see, the next one I did is Precedex. Precedex strip. It's this one. All right, so I'm going to show you this one. It is a little small, I'm sorry. Can some of you see this at least?
Yeah.
So we have a patient with congestive heart failure. You may want to write some of this down. So they've got a Precedex drip infusing at 12 mils per hour. The patient weighs 80 kilograms. And there's a concentration there of 200 mics in 50 mils. It's asking how many micrograms per kilogram per hour is the patient getting? Okay. Some of you have that written down. Okay, let me go ahead and. So let's try this again with that fabulous whiteboard. And I've put it so you can collaborate. So if anybody would like to have a go, I'm happy for them to do it. You get rid of this.
I'd like to set up the problem if you don't mind.
Yeah, let me just try and clear this thing. All right. Do you want to type the information in here first? Is that what you're saying?
No, I was just gonna say how I would set up the problem. I would start with what they want first, which is 200 mcg over 50 milliliters. I'm sorry. They want micrograms per kilogram per hour.
Micrograms per kilogram per
per
hour. So
hour.
how would you set that up?
I would put the equal sign after that.
Well,
and
do me a
then-
favor. Can you get one of
No,
those?
I can't. I don't have access to it.
Oh, all right.
I can do it. Hold on, I can type it. I think. What'd you say, Andre or Victor? I don't remember which one.
It's
it was.
Andre.
Oh, Andre.
Well, it wants micrograms, so the first relationship I would start with after the equals would be 200 micrograms over 50 milliliters.
Before you start that though, Andre, I want to know what you would put before the equal sign, because not everybody knows how to set that up. And that is going to make or break you when you do this question.
It asks for micrograms per kilogram per hour.
Correct. So what are you going to put on the top?
mcg
And what are you going to put on the bottom?
over kg over h.
Good. All right, so let's just put that first. So we're going to do micrograms. I'm sorry, guys. Per kilogram. Oops. All right. And for those of you that aren't familiar with that, that is how you want to set it up. And it will, think of that as a mini formula. All right. That'll help you set the whole thing up. Okay. So what do you want to do next, Andre? What did you want to do next? Hello. Andre.
Oh, I'm sorry. I said I would multiply that by 12 milliliters per hour.
You would put the 200. Yeah.
200 mcg over 50 milliliters, and then I would
All right, so
multiply
let's do
that by
that.
12 milliliters per hour.
Yeah. So we've got the 200 micrograms. Oops. And then my 12 mils. Believe me, that's a mil. Per hour. And what else?
I would put a parentheses around that whole thing, and then I would multiply that by 1 over 80 kg.
Can I do it slightly different? Do you mind if I just?
Yeah.
All right.
Is that what everybody in the class thought?
Yep.
That's how you do it. But the key is knowing this. Setting it up like this. Okay. So what have we got across the top then?
$2,400.
Thank you. And what's on the bottom?
4,000.
Oh my goodness. I tend to get rid of zeros as much as possible. All right, so what does that make it?
0.6.
You got it. Microgram per kilogram per hour, meaning that's what the patient is getting per hour. Whoops, sorry. Is anyone able to get on here and do anything on this? No?
No.
I can't see it.
You can?
I can't. It just says whiteboard in progress.
You can click on
There you go.
I have clicked on it.
Yeah, you can click.
You click on it, you can do it. Sort of fun. I remember sometimes I've done it before and I've had like 10 people jump in on this thing and it's been like chaos, but sort of fun at the same time. So anyway, you want to know if you got that right, don't you?
Yep.
Did you get it right? Oh, where are we? Ta-da! There you go. Good job. All right. So I just wanted to do a couple of those. So that might be helpful for you, right? Those types of things. So we've only got a few minutes before this finishes, and I really wanted to, let's see, I don't have time. Maybe I probably don't even have time to do that. I was going to do a quizzes with you. Let's just, you know, does anybody have questions about what we went over today, first of all? You understand you're going to do your HESI next week. Have you all registered yet for the HESI, on the HESI?
Yes.
I haven't registered yet. I have to register today.
Okay. And somebody had a question about the HESI homework, that it was missing. I have to go in and download and basically get that information, your grade. I have to plug it into the grade book. So I was waiting till Sunday evening till everybody's done, and I'll get those done for you today by the end of the day. So, you know, how are you feeling with this sort of online piece for a second? It's different, isn't it?
Yes.
Yeah.
I like that we can get through a lot of material.
You do?
Yeah, I do.
Yeah. Yeah. There's pros and cons, you know?
Yeah.
Pros and cons. I mean, when it works, it's great. And the fact that I can record, I mean, I could record anyway, but, you know, at least we're able to do a lot of information like this. So, yeah. All right. With that, as I say, the other pieces that I had for you, on Wednesday, we're going to do group work. We're going to do chapter 44, group work, and then we're going to work through the antibiotic chapters. And for those of you who don't know where those are, let me just show you. And I may have modified a lot of what I talk about now in comparison with what I talked about then, I don't know, but at least they are lectures that you can begin to understand penicillin, the beta-lactamase, the different types of antibiotics, antivirals, TB meds, on and on and on, because there's a lot of information with them. So let me just pull you guys up. Is that the one? There it is. All right, so if you scroll all the way down, These are the announcements, okay? These are all the announcements. If you guys scroll, let's see. Here's one. Here's two. Here's another one. So there are three. Okay. This one may not have worked, which is why I did another one here. So have a look at these. It might be helpful for you. There's other lectures here as well that you're welcome to listen to and look at. And then just FYI, exam 3, there's a review here for you as well. This HESI guide is actually for, I think, the final HESI, but you could, you know, they're very, very similar, so you can use that as well. And Daquisha, did you send me that email?
Yes, ma'am, I sent it. I'm gonna actually send you because I don't have a way of sharing how I have the medication set up with the charts. I don't know everyone's information, so I'm probably just going to send you the PDF file to where if you are allowed to send that to everyone, because
I'm just going to put it in the announcements.
Oh, okay.
Yeah. So if you can send me that, I'll just, you know, cut and paste it and put it in the announcements as an extra tool. That would be helpful. Yeah, if you could get that to me today, that would be great.
Okay. Well, I sent the list, but the one that I actually got those medications with your medications and Silva's medications that she listed and put them into my charts, that's the one I also want to send to everyone.
Okay. Whatever you, however you want to do it. I don't know if you guys have a group chat but as I say, if you've got some sort of list, comprehensive list, I can put it in the announcements for everybody.
Okay.
Okay. All right. So at 3 o'clock, let's see, who do I have? I thought I had somebody at 3. Jordan. I have Jordan Kales at 3. So I am going to stop recording. Let me make sure I do that. I'm going to stop